How many of you do have elderly at home that you care for? And how many of you do actually worry about their health, the health of the elderly in our homes? This is Dr. Lenny DaCosta, a geriatric physician, a functional medicine expert, and the author of the upcoming book, Is Your Doctor Keeping You Sick? My dear friends, today we're going to talk about the health of our elderly in our homes. People who have given us a beautiful childhood, helped us grow up, held us when we were toddlers, and showed us the path to where we stand today. But today they need us. So how do we care for their health? If we need to care for the health of our elderly, whether it's our parents, whether it's our uncles, aunties, whether it's our grandparents, we need to understand what are the health risks that affect the elderly in the first place. And I'm going to speak to you today about 6 health risks that are commonly present in the elderly, and modifying what we do at home can give them better quality of life without any kind of disease or any kind of problems while they live a good life. So let's begin. The first thing that we need to look at is smoking. Yes, smoking is an issue when the elderly do indulge in smoking. Why? Because it's the single most cause of premature death. There is increased risk of cancers, coronary artery disease, and stroke in the elderly, especially those who smoke. Then you have conditions like COPD, which is basically chronic obstructive pulmonary disease, which affects your lungs. They keep coughing, they can't breathe properly, they get up in the nights, and of course they have acidity problems or acid peptic diseases, which are common in the elderly. And of course, slowly, because of this, you have low nutrition getting in, they lose their physical function and mobility, and this is normally seen in most smokers. But what nobody tells you is the chances of osteoporosis is much higher when you smoke as an elderly person. You also have a higher risk of all morbidity when you smoke. So the best thing that you can do is actually give up smoking. Then let's look at the number 2 risk, that is physical inactivity. Now, why is it that the elderly are afflicted with physical inactivity? We need to understand one simple cardinal fact. Most elderly start losing their muscle mass by the age of 60, and it keeps declining further and further. So the muscles become a little weak, causing them to start slowing down and stopping their activity that they would want to do, because they feel a little weak and unsteady because of the lack of strength and the decrease in the muscle mass. Over the age, because of this, exercise tolerance also declines. And as a result of all this put together, most elderly tend to be sedentary, tend to be inactive most of the times. Now, what are the benefits of physical activity in the elderly? First, it protects them against cardiovascular disease. Second, it ensures that there is some amount of weight management or weight reduction. Third, it is beneficial for their glucose metabolism. That means it controls their sugars and keeps them under control. Even if you're a diabetic, if you do a little bit of that physical activity, it comes up. But even if you're not a diabetic, the entire glucose metabolism is controlled by your physical activity. Number 4, it protects you against osteoporosis. Number 5, it improves your muscle strength. Even if your muscle mass is declining, if you keep that physical activity on despite feeling a little weak, then you start getting that strength back in those muscles. And then you have so this was 5. Number 6 is improvement. So when you do a lot of physical activity, the chances of improving your psychological well-being is much higher. So when an elderly person is active and agile, the chances of things like depression and senile dementia setting in are remote. And finally, with good amount of mobility in the elderly, there is a greater survival chance. What does this mean? It means that you live longer lives. The more active you are, the more mobile you are, the more physical activity you do, even while you're aging, the chances of you living longer are much, much, much higher. Now, the third health risk that we have in the elderly is alcoholic abuse. Now, alcohol abuse is not seen very rampantly, but as a geriatric physician, I see a lot of the elderly who do abuse alcohol. And what does this do? It predisposes most of the elderly to severe conditions like cardiomyopathies, liver cirrhosis, atrophic gastritis. These are conditions that you don't want. Chronic pancreatitis, peripheral neuropathy, dementia, falls, accidents, malnutrition, immunosuppression, and social isolation. All these conditions actually make the elderly become sick, and they then need medical attention all the time, and their quality of life declines. So with the quality of life, their survival rates also decline. Then most elderly do take a lot of medication. So when you have alcohol intake regularly, it kind of has a cross reaction with some of the medications they are taking, which can either potentiate the effect of those medications or can create other complications. And lastly, we must remember that in the elderly, small amounts of alcohol can cause issues because the alcohol tolerance in the elderly goes down drastically. So the best thing to do is avoid alcohol as far as possible for a better quality of life, to avoid any kind of chronic diseases that would get the elderly in hospitals and under medical treatment. The fourth health risk that we have is something known as polypharmacy. And what is polypharmacy? You see, this is something that is so common. As a geriatric physician, I see tons of my patients who come to me, and they would come with 2 or 3 prescriptions from various doctors. Over the period of time, we have lost the importance of a family physician. And therefore, what happens is when we have a heart problem or a cardiac issue, we go to a cardiologist. He writes out a prescription. Then we suddenly are told that we have some problem with our kidneys. So we go to a kidney specialist, a nephrologist. He writes out another prescription. Sometimes those 2 prescriptions overlap, in the sense the same medications with different trade names are there in both the prescriptions. We don't rationalize those prescriptions. We don't show one prescription to the other doctor sometimes. It's not done on purpose, it's just that we forget. As elderly, most elderly forget to show their prescription. They say, yeah, we take these medications, and they rattle out, but they don't carry the older prescription, or maybe the cardiologist when they go to see the kidney specialist. And therefore, you have multiple drugs being taken in a double dose. This is known as polypharmacy. Secondly, most elderly tend to go to the counter, the pharmacy, and buy things over the counter. This itself can cause a lot of problems because over-the-counter medications do have side effects, and they can create a lot of problems. So both these need to be looked at when we look at the elderly. We need to have a way of rationalizing. So when any elderly goes to a doctor, which specialist, you always carry that prescription to another doctor when you go and say, doc, this is what was given. Can you just check whether there are any duplication of medications? And this way we can avoid these problems. So my dear friends, polypharmacy is something that we don't understand, or we don't tend to take too seriously. But it is a condition that I have seen, and it is a risk that I have seen in most of the elderly that come to see me. And that risk is dangerous. Why? Because when you take a double dose of medication, you can have side effects from an excess dose of medication. Yeah. One of the ways that we need to be alert to polypharmacy is if the patient is in a kind of delirium, drowsy, tends to fall, suddenly has lost his ability to be mobile or active. All these are pointers that there is a problem with the medication that he or she is taking. And this is one of the ways that you can actually cross-check what medication is taking. Go back to the doctor, go to a family physician and say, can you just rationalize or see these prescriptions if they are okay, or if there is an excess, or if they're at a double dose of any medication, all right? Then we have the health risk of decline. I mean, this is the fifth one, is decline in immunity. Elderly have dysfunction in all aspects of the immune system. And the immune suppression is sometimes mainly because of malnutrition, chronic disease, but very importantly, many a times because of depression and use of multiple medications, which affect the health of the elderly. So we need to understand this and ensure that most of our elderly at home do get good nutrition, don't get depressed, and are kept in good humor at all the times. Keep them occupied or engaged with conversation regularly. Be a part of the life. Ensure that they have something to do which keeps them from being depressed, and always check on the medications that they're taking, because these medications can cause a decline in immunity, which can lead to other issues. And finally, you need to ensure that you have all the drugs cross-checked to prevent adverse drug reactions. And this can be done by minimizing the number of drugs that you use and limiting the over-the-counter drugs. My dear friends, these are some of the pointers that I've given you towards the risks that afflict our elderly in our homes. If we need to give them the best quality of life that all of us want them to have, we need to ensure that we minimize these risks. If you like this video, please give me a thumbs up, share it with your friends who have elderly at home, so that it can be easier for them to provide the kind of quality of life they want to give their elderly at home. And do visit my YouTube channel to see more beautiful, wonderful health videos that I've created for you, so that you can have a happy, healthy life. I'll see you soon in my next video. Till then, stay safe. Bye.